About the Ohio teenager making national headlines for going against his parents' wishes and getting vaccinated. 10 states have reported cases of measles. Ohio isn't one of them. But News 5's Jesse Schultz found out that doctors are concerned it may just be a matter of time.
The numbers speak for themselves. Last year in the U.S., we had 372 cases of the measles. This year already, from January 1st to last week, 101 cases. I found this outbreak is pushing those on both sides of the vaccination debate further in their corners. Stephanie Stock is a working mom of 2 boys in Northeast Ohio. She's also a mom who now chooses not to vaccinate those boys.
My oldest son, he had a vaccine reaction at 4 months. And my doctor told me, oh, you know, it was a coincidence. These things happen sometimes. I knew something was very wrong.
Her son is okay, but she stopped vaccinating after that.
Not vaccinating is like dry patches of grass. And the more dry patches of grass, the more likely you could have a fire.
In order for herd immunity to work, about 90 to 95% of the community needs to be vaccinated. CDC numbers show last school year in Ohio, 92.1% of kids received their measles, mumps, and rubella shots. But experts say just because we're in the range doesn't mean we're safe from an outbreak. It's just a flight away.
You have people coming in from outside. And so all you need is a few children who are not immunized to be affected, and then they will spread it to other children.
Ohio's percentage of kindergartners with a vaccination exemption last year was 2.6. That's higher than the national median. Parents in Ohio schools can opt out with exemptions for medical, religious, or philosophical reasons. And for parents like Stock, she says it's their right to do so.
It is every parent's own responsibility to protect their own child. We cannot in America be deciding that we're protecting communities and that we're sacrificing our children at the expense of a community.
But for doctors, the concern that diseases we've considered eradicated will come back continues to grow.
The 3 most important things for child health in the last 150 years has been clean water, sanitation, and vaccines. That is what made the difference for children living to see their first birthday and their 10th birthday.
Lawmakers in both Washington and Oregon, states that have seen outbreaks this year, are considering ending philosophical vaccine exemptions for schools. Meanwhile, in Ohio, if there is a measles outbreak at a school, students who have an exemption have to stay home for 21 days after the last known case clears up. Jesse Schultz, News 5.